Hi, good morning. We are Group 1. Our members are myself, Heidi Francis, Stephanie Maharaj, and Bernadine Marchand. Our topic today is substance abuse because it is a lifestyle problem which can affect the members of the childbearing family. Introduction. For many years, mothers have been warned about the dangers of substance abuse while pregnant. While some took note of these warnings, others have continued to participate in the behaviors that can have a long term harmful effect on the embryonic development. We will investigate chemicals that alter fetal development while analyzing the nurse's role in family planning and the applicable laws in Trinidad and Tobago. Now we will identify common use drugs which will affect the fetus physiology. We have the prescribed and non-prescribed, which will go in depth. Now we take a look at the prescribed drugs. So we have anti-seizure medication. So medicine used to control seizures can also affect a baby growth in the womb. Some of these drugs can cause birth defects if taken during early pregnancy, especially during the first 12 weeks when the baby organs are forming. For example, valproic acid is known to increase the heart defects and cleft lip. These medications can also lead to facial differences, finger and toe abnormalities, delayed growth, and delayed development in later in life. However, seizures in the mother can also be dangerous to the baby. So it's important that the pregnant mother talk to the doctor to find out the safest, treatment during this period. Then we have antidepressants. As it states, it's used to treat depression and anxiety. Most of the medicine is considered low risk during pregnancy, but are still possible effects. If taken in the last trimester, may cause neonatal adaptation syndrome. That's simply a condition where the baby may be shaky or have trouble feeding or breathing quickly or even cry more than usual. This usually goes away within a few days. So, we are in some, for example, paroxetine in the first trimester has been linked to slightly higher risk of heart defects. Some studies also suggest a possible link between neonatal behavior syndrome and persistent pulmonary hypertension of the newborn, a rare but serious lung condition. Treating depression during pregnancy is very important because severe depression can also harm both mother and baby. Then we go on to opioids. Opioids such as morphine can cross the placenta and affect the baby's development. One of the most common issues, as mentioned, is neonatal abstinence syndrome (NAS), where the baby is born dependent on drugs and experiences withdrawal symptoms like tremors, crying, vomiting, or even diarrhea. Opioids use is also linked to low birth weight, preterm birth, and poor fetal growth or even stillbirth. Long-term effect on the child may include attention issues, learning difficulties, and behavioral problems. If opioid treatment is medically needed during pregnancy, the doctor often manage it carefully and using safer dosage and also regular monitoring. Then we have benzodiazepine, such as, for example, Valium. I used to treat anxiety, panic attacks, and sleep problems. These medications can affect the baby, especially when taken in large doses or for a long time. If used early in pregnancy, there is a small risk of birth defects, such as the cleft lip. If taken in the last trimester or even close to delivery, the baby may be born with a floppy infant syndrome, a condition where the baby is weak or sleepy and has poor muscular tone or trouble breathing or feeding. Baby may also show withdrawal symptoms like jitters and crying. Some research has suggested that long-term exposure may lead to delays in major motor or learning problems. Benzodiazepine are necessary during pregnancy. If it is needed, the doctors usually recommended the lowest effective dose for the shortest possible time and also monitor the mother and the baby at the same time. Now we have some non-prescribed drugs. First, marijuana. Marijuana is one of the most commonly used drugs during pregnancy, but can still affect the baby's development. The active ingredient is obviously marijuana, crosses the placenta and reaches the baby. This may lead to low birth weight, premature birth, or problems with the brain development. Some studies have shown that babies exposed to marijuana while in the mother's womb later in life have problem solving and learning difficulties. Although it may be deemed as natural, it is not considered safe during while pregnant, consuming while pregnant. Alcohol. Drinking alcohol during pregnancy can cause a wide range of long life problems for this fetus. Alcohol easily crosses the placenta and can damage the baby's brain, heart, and even the other organs. Heavy drinking can lead to miscarriage and stillbirth, and also a condition called fetal alcohol spectrum disorders, FASD. Babies with this have small heads, flat faces, and growth problems and also brain damage, and they often struggle with learning and behavioral and social skills problems. There is no safe amount of alcohol that needs to be consumed during pregnancy, just none at all. Then we go to cocaine and heroin. Cocaine is a powerful stimulant that can have dangerous effects on both the mother and the fetus, right? Cocaine itself reduces the blood flow and oxygen to the baby, which can cause a miscarriage, right? And like preterm birth and stillbirth. Babies exposed to cocaine in the womb are often born with low birth weight and have poor muscle tones and feeding problems. Later in life, these children may show signs of attention deficit and behavioral problems. Cocaine also increases the risk of birth defects of the brain and the heart. And heroin is an illegal opioid, as we mentioned before, that possesses serious risk to the developing baby. It as cocaine, it causes miscarriages, low birth weight and stillbirth, and the baby usually suffers uh, as a neonatal abstinence syndrome, NAS, which causes withdrawal symptoms like tremors and crying, sleep problems. These babies are often need special care in the hospital for several weeks. Long-term effects also include learning problems, behavioral issues, and developmental delays. Heroin also puts the mother at risk for higher risk of infection like HIV and hepatitis, which will also be passed on to the baby. Now we'll look at some others non-prescribed drugs. Methamphetamines are strong stimulant drugs that speed up the body system, but they can be very harmful to the developing fetus. When a pregnant woman, let's take for example, uses meth, the drug crosses the placenta and reaches the baby, causing a reduced blood flow and oxygen. This increases the risk for a miscarriage, and the fetus can have low birth weight and also even stillbirth. Babies exposed to meth in the wombs may also be born smaller and have trouble feeding and sleeping problems. As they grow, they can struggle with attention, memory, and behavior problems, including a higher risk of ADHD and emotional difficulties. Meth use also increases the mother risk of high blood pressure, heart problems, infection, and can cause, have a effect on the pregnancy. Then we have nicotine, such as cigarettes, vaping, or tobacco use. Nicotine found in cigarettes and, chewing tobacco and vape, that's the new thing now, is highly addictive and harmful during pregnancy. It narrows the blood vessels, including those in the placenta and the umbilical cord, which reduces oxygen and nutrients going to the baby. This can cause a low birth rate, premature birth, birth defects, especially the heart, and the growth restriction in the womb. Smoking during pregnancy also increases the risk of miscarriages and also a sudden infant death syndrome, SIDS. Babies exposed to nicotine may also experience withdrawal symptoms after birth, like feeding problems, and will have long-term effects such as learning and behavior problems. Even secondhand smoke can harm a developing baby, so avoiding all forms of tobacco and vaping is important during pregnancy. The effects of drugs on the fetal well-being. Firstly, development issues. Drugs including alcohol, tobacco, and illicit substances can cross the placenta and harm the fetus. This can lead to birth defect, low birth weight, preterm birth, and developmental delays. Secondly, cognitive and behavioral. Prenatal exposure to substances like cocaine, alcohol, and marijuana can result in a long-term cognitive and behavioral challenges such as attention deficits and learning difficulties. 3. Physical health risks. Some drugs like opioids can cause neonatal abstinence syndrome where newborns experience withdrawal symptoms after birth. The effects of drugs on parenting. Effects on bonding. Substance use can interfere with a parent's ability to bond with their child, impacting emotional and psychological development. 2. Parenting capacity. Addiction can impair judgment, stability, and the ability to provide a safe and nurturing environment. 3. Intergenerational impact. Children of parents with substance use disorders may face increased risk of neglect, abuse, and developing substance use issues themselves. 4. Legal and social consequences. Substance abuse during pregnancy can result in legal consequences, including loss of custody or intervention by child protective services.
Roles of the nurses in the childbearing family. Health promotion and education. Educating families on nutrition for both mother and baby, whilst emphasizing the importance of balanced diets, prenatal vitamins, and hydration. Nurses are critical in supporting the childbearing family in developing and maintaining balanced and healthy lifestyles, with responsibilities encompassing education advocacy, emotional support, and advanced clinical care. Preventative care and screening. Conducting prenatal screenings for conditions like preeclampsia, infections, and gestational diabetes. Nurses also monitor maternal health and fetal health through routine checkups and screening during antenatal clinic visits. Emotional and psychological support. Nurses provide counseling to address symptoms of stress, anxiety, and even postpartum depression, as the postpartum period can be very challenging for new mothers. Roles of the nurses continued. Advocacy and community supports. Advocating for safer environments, including guidance on home safety for the baby, proper use of car seats, and avoiding harmful substances like drugs and alcohol. Nurses also ensure sensitive practices by supporting culturally sensitive care, ensuring that suggested recommendations align with family beliefs, practices, traditions, and values. Labor and delivery assistance. Providing physical and emotional support during labor and delivery as a caretaker is important. Nurses do this by supporting and guiding women through a series of comforting methods and providing updates on their progress. Moreover, educating the patient and their relatives on pain management options, including breathing techniques and medical interventions, allow the parents to make informed choices prior to labor. Finally, nurses assist with postpartum care immediately after birth, such as skin-to-skin contact and breastfeeding initiation, like latching on. Postpartum and infant care. Supporting and encouraging breastfeeding for new mothers, showing them latch techniques and breastfeeding positions, promoting breastfeeding and addressing patient concerns. They also educate the parents on safe infant care practices. These include bathing the baby, sleep safety, and recognizing signs of illnesses. Most importantly, nurses keep monitoring the mother's recovery time, as this is essential for identifying complications such as hemorrhaging or infections.
My name is Belinda Marchand, and I'll be talking about laws and regulations which protect the childbearing family from harmful drugs. In Trinidad and Tobago, multiple laws and regulations are in place to protect the pregnant and breastfeeding mothers and their children from hazardous substances. Children's Act 2012, the laws that protect children. Child protection, methods to protect the child from neglect, abuse, and exploitation. Parental responsibilities, the duties of bereaved parents or guardians in caring for their children. Legal framework, the welfare of the child is the main priority. Children's Authority Act 2000 establishes the Children's Authority in Trinidad and Tobago. Its mandate to ensure that children are protected and cared for, and that those in difficult situations receive assistance. When a report is filed, an investigation is conducted to confirm that there is no child abuse and that the child is safe. The Foods and Drug Act. It is a framework for ensuring that manufacturing, sales, and distribution are done safely and correctly. This will allow distributors to avoid infected or checked medications that can harm a pregnant mother during nursing. The Pharmacy Board Act. This protects patients by encouraging proper prescription distribution and counseling, especially for medications that may pose a risk to the pregnant or breastfeeding infant. The Dangerous Medications Act. Proper care and handling of opioids and psychotropic medications minimizes access, preventing harm to the mother and infant. Trinidad and Tobago provides various support services to help families at risk of substance abuse for the childbearing family. These services are designed to offer holistic care encompassing counseling, rehabilitation, and educational initiatives. Now, I'll be talking about different support services and programs that can help the child-bearing family members who are at risk of substance abuse. The National Alcohol and Drug Abuse Prevention Program, also known as NANDAP. This program oversees initiatives for preventing drug abuse and reducing demand in Trinidad and Tobago, and assists non-governmental organizations in their efforts to eliminate the problem of drug abuse in the nation. NANDAP aims to decrease both illegal and illegal substances abuse through a preventative strategy by educating the public on the health and social impacts of substance misuse and promoting the advantages of maintaining a healthy lifestyle. Childline, Trinidad and Tobago. Childline provides a helpful service that operates 24/7 for children and young individuals up to the age of 25. They offer support, care, and guidance, which includes counseling and emotional assistance, crisis intervention, and referrals to additional child protection services. Their offerings also encompass workshops and webinars covering subjects like substance abuse, mental health, and parenting skills. Family Counseling Services. Founded in 2004, Family Counseling Services provides counseling and therapeutic support for both individuals and families. They offer interventions for substance and drug addiction, life skills education, and assistance for families facing challenges related to substance use.
So, in conclusion, the evidence provided suggests that drug abuse during pregnancy poses significant threat to fetal and maternal development, with both types of drugs, prescribed and non-prescribed substances, potentially having the ability to cause serious health problems for the unborn fetus and the mother. Additionally, drugs like opioids, nicotine, and alcohol continue to promote fetal developmental issues such as birth defects and cognitive disabilities. Notably, the role of the nurse is vital in encouraging healthy lifestyle changes within the childbearing family through educational advice, emotional supports, preventative care, and patient advocacy. To add to this, legal initiatives like the Children's Act and the National Alcohol and Drug Abuse Prevention Program in Trinidad and Tobago aid in the protection of vulnerable families from the drastic effects of substance abuse and misuse. Ultimately, all efforts to yield mandatory support systems are critical in safeguarding both the childbearing family and maternal and fetal health, emphasizing the need for specific interventions and resources to tackle the ongoing issue of substance abuse successfully. We would like to thank you for listening to our presentation. Any comments and questions will be received now.
These are our references.